Well, this is a young woman who actually came to our maternal fetal medicine program in the early stages of pregnancy. The obstetricians in the program recognized that she had a heart murmur. She knew she'd had a heart problem since she was a child. In fact, she knew she was born with pulmonary stenosis, and that's a condition where a valve is narrow, creating a blockage inside the heart, and that limits the amount of blood that can actually flow through the heart and through the lungs. Well, under ordinary circumstances, she was fine, but with pregnancy, you have to increase the amount of blood flow through the heart to supply the baby. And we know that during the middle of pregnancy, that inability to get more blood through the heart can put the mother's life at risk and the baby's life at risk. So this was a big shock to this lady to come to our clinic, our adult congenital heart clinic, and find out that she had a potentially life-threatening condition when associated with pregnancy. Life-threatening to her, life-threatening to her baby. We talked to her. She and her husband desperately wanted to have this baby. They were so devoted to the concept of being parents that they really wanted to continue the pregnancy. So we pulled together the interventional cardiologist from Packard, Dr. Perry and his crew. We pulled together the maternal fetal medicine and our adult congenital heart colleagues, and we came up with a plan whereby we would watch her very closely. We would wait, if we could, until the baby was a little more fully formed, but we would act immediately if she developed symptoms or problems. And we had plans in place for every step of the way and watched her closely. Well, sure enough, about a third of the way into the pregnancy, she became very symptomatic. And within hours of her reporting those symptoms to us, we had her in the hospital at Stanford. We had the cath team assembled, and that evening, that same evening, Dr. Perry was able to perform this procedure whereby he put a balloon in the heart, he blew the balloon up, he opened the valve, got a perfect result. And within hours, she went from a high-risk pregnancy with a high chance of losing her baby or having serious damage to herself to having a low-risk, normal pregnancy. And now you can see the results. You've got a happy lady, a happy father, a very beautiful baby, and a great outcome for her in the future as well. Her outlook is quite good. This procedure is nearly curative for her. So we pulled together people from different disciplines, 2 different hospitals, all specialists in their own areas, to work with this family for her specific problem. Very exciting.
Even though the odds were against us, due to Dr. Murphy and his team, and Dr. Perry and his team, and Dr. Chue and her team, were very instrumental in getting us right here sitting with our baby.